Healthcare in Vietnam. Progress, challenges, and the path forward. Vietnam's healthcare system reflects the country's rapid socio-economic development, demonstrating significant progress in public health outcomes while grappling with various challenges. Over the past decades, Vietnam has improved the quality of healthcare, expanded access, and implemented numerous reforms, contributing to higher life expectancy and better overall health for its population. However, issues such as resource constraints, healthcare inequality, and the burden of infectious diseases remain key concerns. This essay explores the current state of healthcare in Vietnam, its achievements and ongoing challenges, offering insights into the country's journey toward ensuring better health for all its citizens. Achievements in healthcare. Vietnam has made remarkable progress in public health, particularly in increasing life expectancy and improving access to essential healthcare services. By 2016, the life expectancy in Vietnam stood at 80.9 years for women and 71.5 years for men, ranking the country second in Southeast Asia after Singapore. This is a testament to Vietnam's healthcare system, which has grown considerably since the country's reunification in 1975 when a nationwide health service was established. Access to clean water is another important public health achievement, with 97% of the population having access to improved water sources by 2015. This access has played a critical role in reducing the incidence of waterborne diseases, particularly in rural areas. The country has also made significant strides in addressing infectious diseases. One notable success is the fight against malaria. By introducing improved anti-malarial drugs and treatments, Vietnam reduced its malaria mortality rate by 95% from its 1990 levels by 2005. This success is a result of coordinated efforts by the government and international health organizations to distribute medication, raise awareness, and improve access to healthcare in remote areas. Challenges in healthcare. Despite these positive developments, Vietnam's healthcare system faces several challenges. One major issue is the shortage of healthcare resources, particularly in terms of hospital infrastructure, healthcare workers, and medical equipment. For example, in 2000, Vietnam had 24.7 hospital beds per 10,000 people, which declined to 23.7 beds by 2005. This shortage puts immense pressure on state hospitals, leading to overcrowding and longer waiting times, especially in urban centers like Hanoi and Ho Chi Minh City. The country also faces a shortage of healthcare professionals. While Vietnam boasts a growing system of medical and pharmaceutical universities, producing thousands of graduates each year, the number of doctors, nurses, and other healthcare professionals remains insufficient to meet the population's needs. The health workforce is estimated to have around 250,000 workers, with 47,000 having university degrees. These numbers fall short, especially in rural areas where access to qualified medical personnel is limited. Another significant issue is the rise of tuberculosis, TB. Despite advances in healthcare, TB remains a major public health challenge in Vietnam. It is the second most infectious disease in the country after respiratory illnesses. The government, along with international partners, has intensified efforts to combat TB through vaccination programs and better treatment options. But the disease continues to pose a significant burden on the healthcare system. Additionally, Vietnam's battle with HIV/AIDS persists. By 2005, the country had diagnosed over 100,000 cases of HIV, with thousands progressing to AIDS. Though the infection rate has stabilized at around 0.4% of the population, the healthcare system still faces challenges in controlling the spread of the virus. Vietnam receives global aid, particularly from organizations like the Global Fund to Fight AIDS, Tuberculosis, and Malaria, which plays a crucial role in financing efforts to prevent and treat these diseases. Infrastructure and the role of private healthcare. Vietnam's healthcare infrastructure has expanded significantly, with 1,030 hospitals, 44 rehabilitation centers, and 622 polyclinics as of 2010. The country also has 246,300 hospital beds, and its grassroots health network covers 80% of villages, ensuring that most communes have access to health stations. In addition to state-run health services, a private healthcare system has emerged in Vietnam. There are nearly 20,000 medical practices and 14,000 pharmaceutical practices operating privately. The development of private hospitals and clinics, including foreign-invested private hospitals, has contributed to reducing the burden on public healthcare institutions. These private services offer alternatives, often with shorter waiting times and higher quality facilities, though they are typically more expensive, making them accessible primarily to wealthier segments of the population. Health reforms and international support. Recognizing the need for continuous improvement, the Vietnamese government has implemented healthcare reforms aimed at improving the quality of services and expanding access to healthcare, particularly for the poor. In 2004, government subsidies covered 15% of healthcare expenses, and more recently, efforts have focused on providing health insurance to more citizens. However, the management of healthcare services, including health insurance, remains vulnerable to corruption, which affects the quality and fairness of service delivery. Vietnam's health sector also benefits from substantial international support. As of 2010, the Ministry of Health managed 62 official development assistance, ODA, projects and over 100 NGO projects, with a total budget exceeding $1 billion. This funding helps to bridge gaps in healthcare provision, improve infrastructure, and fight infectious diseases like malaria, TB, and HIV. Ongoing public health concerns. Vietnam continues to face public health challenges related to lifestyle and cultural habits. One notable issue is the consumption of dog and cat meat, which is linked to diseases such as rabies and leptospirosis. In 2018, the Hanoi People's Committee urged citizens to stop eating these meats, sparking widespread debate. While the recommendation received positive feedback from many on social media, the practice remains ingrained in certain regions and cultural traditions. Additionally, the legacy of war continues to impact Vietnam's public health. The use of herbicides, particularly Agent Orange, by the U.S. military during the Vietnam War left long-term health consequences. Millions of Vietnamese people suffer from health problems associated with exposure to these chemicals, including birth defects. This legacy remains a public health concern that the government, with the support of international partners, is working to address. Conclusion. A path forward. Vietnam's healthcare system has come a long way, achieving significant improvements in public health outcomes and expanding access to services. The increase in life expectancy, access to clean water, and successful campaigns against malaria reflect the country's commitment to improving the health of its people. However, challenges remain, particularly in terms of resource shortages, the rise of infectious diseases like TB, and the management of healthcare services. Looking ahead, continued investment in infrastructure, training for healthcare professionals, and the fight against infectious diseases will be essential to ensure that Vietnam's healthcare system meets the needs of its growing and aging population. International cooperation, alongside domestic reforms, will remain crucial in addressing these challenges and ensuring that Vietnam can continue on its path toward better health for all. By building on its achievements and addressing current limitations, Vietnam can develop a healthcare system that not only serves its people today but also paves the way for a healthier, more prosperous future.